Hi, everybody. I'm François. I'm based in Johannesburg. I'm going to be talking to you about the COVID-19 vaccines and the role into Africa. And these are my disclosures. I could rant and rave about how absolutely what an obscenity is going on in Africa at the moment. The fact that 10% of people are vaccinated in a world where everyone's carrying on about whether or not they should have their fourth vaccine, and it is an obscenity, and we should make no mistake about that. But I think I'm talking to the converted here, and that most people would agree with me that are on this webinar. So let's rather talk about practical things we can do, which I'll be focusing on my next slide. So what can be done, though? What should we be thinking about as we're looking at this? And I think the first thing is we need to be keeping a beady eye on Big Pharma on this. You know, there are the secrecy and the patents issues have been cemented over the COVID epidemic. In my own country, terrible secrecy agreements have been signed behind closed doors around how much we've been paying for vaccines, how vaccines are administered, how tech transfers happen. And you know, we're not even allowed to know which officials in government have signed these deals. There's been a collusion with a lot of rich countries around these patent protections. A lot of these agreements have been kept secret. And a lot of these vaccines have been developed with public money in both the US and in Europe. And I think people need to be calling out this nonsense that's been going on. There have been some limited forays into providing tech transfers across to Africa, often with collusion of African governments. And again, we need to be calling this out, that we need capacity, we need tech transfers. The Pfizer vaccine is looking like it's going to be the most successful, most profitable drug ever manufactured in the history of drug development. And we need to, again, to be asking the questions about equity, about what is fair, return on investment as we go forward, and particularly as these new drugs come on board. We also need to be very careful about what is often lobotomized epidemiology. People keep saying, oh, you know, it's very convenient to say that Africa's death rates have been very low. And anyone with, as I said, who knows anything about epidemiology will be very critical of those kinds of statements. The African population is younger, but if you do age-matched categorizing for that, you will know that either the data is very poor, but the limited data that we do have shows that pretty much the death rates are as bad as anywhere else in the world. It's just a very convenient fiction to be able to say, oh, you know, we don't need to worry about Africa. We don't need to worry about vaccinating them because, you know, they're not going to die anyway. And we need to be very cautious about this because these new antivirals that are on their way, which we need to have available for people with who are vulnerable, will be required on the continent as much as they're going to be required elsewhere. I think we're very clear that this virus is not going anywhere, that Omicron has, while the sequelae have not been as severe as with the previous 3 waves, there certainly are people who are vulnerable who are going to be hurt. And we need to have both vaccines and antivirals available for people going forward. But we also need to be very critical of African governments, you know, including my own, who have found very wanting. Why were they not able to distribute the vaccines that were made available? In my own country, millions of doses of Pfizer vaccine are currently being destroyed because they weren't able to distribute them. You know, they were just kind of parachuted in and sat back and awaited people to passively come forward and get vaccinated. And again, the lack of investment in health systems by African governments needs to be called out. And at the same time as calling out everyone else's passive approach to the continent. And finally, I think we need to ask why the people who have done stuff that have been very effective at getting programs out there, particularly at antiretroviral programs, why did they not use the people experienced with the PEPFAR programs in Africa? You know, for everything from PrEP, male circumcision, to antiretroviral testing, for HIV testing and antiretroviral provision. Why did we not use the lessons learned there to get COVID vaccines out to the continent? Why were those people on the sidelines? Why were they not brought in to try and help get the distribution levels done? The kind of hesitancy we saw around PrEP, around male circumcision, we've seen with COVID-19 vaccines. And I really am somewhat distraught at the fact that, you know, the people who actually had experience with these large implementation programs, we did not lead on them nearly enough to get the vaccines out there. And I'm hoping that over the next year or two, that we'll take the lessons learned from the HIV programs and start applying them to these vaccine programs. Thank you very much.